Hi, I'm Elise Gode, and this is my Health 412 PSA on HIV/AIDS. The HIV infection is caused by the human immunodeficiency virus, otherwise known as HIV. After HIV is in the body, it starts to destroy CD4 positive cells, which are white blood cells that help the body fight infection and disease. The HIV life cycle consists of 10 different steps. The first step is when the free virus enters into a human cell. It inserts its DNA into the cell's DNA. After several other steps, the, the new virus cell is released into the bloodstream where it matures and infects the entire body. HIV is spread when blood, semen, or vaginal fluids from an infected person enter another person's body, usually through sexual contact, from sharing needles when injecting drugs, or from mother to baby during birth. Transmission of HIV can occur in other ways. Some are unprotected vaginal, anal, or oral sex, sharing needles during drug abuse, transfusion of HIV-infected blood, infants born to HIV-infected mothers, breastfeeding by HIV-infected mothers, using improper sterilized hospital tools, transplantation of infected organs. Prevention starts with getting tested. If you get tested regularly for HIV and other STIs, then you will know your status, and you should encourage your partner to get tested as well. Use condoms all the time. Practicing safer sex at all times is another way to prevent HIV infection. And don't share needles, toothbrushes, or razors. There are currently 5 different classes of HIV drugs. Each class of drug attacks the virus at different points in its life cycle. So if you're taking HIV meds, you will generally take 3 different antiretroviral drugs from 2 different classes. This regimen is standard for HIV care, and it's important. That's because no drug can cure HIV, and taking a single drug by itself won't stop HIV from harming you. Taking 3 different HIV meds does the best job of controlling the amount of virus in your body and protecting your immune system. Symptoms of HIV include fever, weight loss, malaise, headache, neuropathy, lymphedema, rash, nausea, vomiting, enlargement of the spleen and liver, myalgia, sores, and thrush. In the United States, more than 1.1 million people are living with HIV infection, and almost 1 in 6 are unaware of their infection. Gay, bisexual, and other men who have sex with men, particularly young Black African American men, are most seriously affected by HIV. By race, Blacks or African Americans face the most severe burden of HIV. The CDC estimates that over 1 million persons aged 13 years and older are living with HIV infection, including over 180,000 who are unaware of their infection. Over the past decade, the number of people living with HIV has increased, while the annual number of new HIV infections has remained relatively stable. Still, the pace of new infections continues at far too high a level, particularly among certain groups. The estimated incidence of HIV has remained stable overall in recent years. About 50,000 new HIV infections occur per year. Within the overall estimates, however, some groups are affected more than others. Males who have sex with males continue to bear the greatest burden of HIV infection, and among races or ethnicities, African Americans continue to be disproportionately affected. In 2011, an estimated 49,273 people were diagnosed with HIV infection in the United States. In that same year, an estimated 32,052 people were diagnosed with AIDS. Overall, over 1 million people in the United States have been diagnosed with AIDS, and an estimated 15,529 people with AIDS diagnoses died in 2011. Nationally, Louisiana ranked 4th highest in AIDS case rates and 11th in the number of AIDS cases diagnosed in 2008. The Baton Rouge metropolitan area ranked second for AIDS case rates among the largest metropolitan areas in the United States in 2008. New Orleans metropolitan area ranked third. HIV continues to disproportionately affect African Americans in Louisiana. In 2009, 76% of newly diagnosed HIV cases and 76% of newly diagnosed AIDS cases were among African Americans. Lafayette is known as Region 4. This includes Acadia, Evangeline, Iberia, Lafayette, St. Landry, St. Martin, and Vermilion parishes. As of December 31st, 2011, 1,320 persons were living with HIV infection in Region 4. 717 of those had an AIDS diagnosis. The number of persons living with HIV infection has increased each year in Region 4. 75% of persons living with HIV infection in Region 4 are male, 25 are female, 57% are Black, 38% are white, and 4% are Hispanic or Latino. Persons aged 45 and older represent 52% of persons living with HIV infection. 43% of persons are between the age of 25 and 44, and 6% are under the age of 25.